Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, there are 4 days to go until the Vet Rehab Summit, and my team and I couldn't be more excited. This event is one of our favorite highlights of the year. We love seeing all of you online and connecting with our amazing Vet Rehabber community. So last year we had an incredible turnout. We had 5,050 registered attendees from 81 different countries. We've got a group chat. It's always buzzing. There are so many conversations. And what I love to see is the networking with vet rehabbers from all over the world. If you don't know what the Vet Rehab Summit is, it's our annual online veterinary rehabilitation conference. And this year we're tackling the ethical challenges faced by vet rehabbers. We're diving into specific ethical dilemmas. We have an opportunity to define our personal and professional boundaries around these dilemmas. And we discuss how education and awareness can drive positive change in the issues that we care the most about. Now, if you're looking to get a ticket, you can go to vetrehabsummit.com. If you're an Onlinepethealth member, you can get free VIP access to this event. If you're not, you can choose between a full access ticket, but you can also sign up for a free limited access ticket. And this includes a live webinar called Placebo Treatments in Evidence-Based Practice, Ethical or Non-Ethical. So if you're listening to this after the event, our Vet Rehab Summit recordings are available to our Onlinepethealth members in the Onlinepethealth membership. Today we're going to chat with Tanya Grantham and discuss the compassion and ethical care in our patients, especially those approaching end-of-life care, and the decisions that our clients have to make. Anae and Tanya discuss the ethical responsibility, our own feelings of failure and inadequacy sometimes around these decisions, the feeling that we haven't done the job that we were supposed to, and a lot of the beliefs that we have around end-of-life care, and so much more. It's a really, really good conversation to have, and sometimes something that we don't actually think about too much. Before we head over to that chat, a quick word from our sponsor. Curacao Vet is owned by Nada Robinson. Nada first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate program, and this was in 1998. She developed a science-based platform for veterinary acupuncture, which is the first of its kind. And today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. They've got courses such as medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. So if you want to find out more, you can go to curacao.org, or you can also see them at this year's Vet Rehab Summit this Saturday, 31st of August. So over to Tanya and Anae.
Hi guys, and welcome. Hi Tanya, thank you for joining me.
Hello. Hi everyone. Thanks for joining us, and thanks Anae for the invitation.
Yeah, absolutely. It's always awesome chatting to you, Tanya. Always interesting conversations. So today we're going to be looking at balancing compassion and ethics in end-of-life care. We're going to have some ethical conversations and ask some questions and see where the conversation takes us in preparation for the Vet Rehab Summit on the 31st of August, where Tanya is one of our lecturers. So Tanya, will you introduce yourself and let us know a little bit more about who you are and what your interest is in today's topic?
Cool. I'm Tanya Grantham. I graduated as a vet a very, very long time ago. And about halfway through my career, as it stands now, I transitioned to physical rehabilitation and pain management. I have a very big interest in acupuncture and also in facilitating our patients. I'm primarily dogs and cats, to facilitate them into a really good quality of life. And along with the good quality of life for me comes a good death. which is actually what euthanasia means in Greek. It means the right to a good death. And death is something we don't talk about. I've had lots of, you want to know why I'm interested in my own personal life and in my family, had to deal with death at a very young age. And so I learned when I was young that people don't speak about it. And you kind of like left alone. And so therein lies my interest in it. It's not morbid. It's not a morbid fascination at all. It's like, how do we facilitate, or how do we ease the decisions? How do we have more conversations about end of life? You know, the dogs had a good quality of life. That's what we strive for as vet rehabbers. And now, how do we transition from the good life through the uncomfortable phase to the good death?
That is so powerful. I definitely want to go a little bit more into that. Into giving them a good death, a good ending. Tanya, I've always thought for the same thing for me really is I lost my mom a few years ago, and it was a horrible and very traumatic experience for me. She died from cancer, and watching her go through that deterioration until the end, knowing that it's coming, knowing there's nothing we can do, was really hard. And that experience shifted my perspective around what our animals go through hugely, because for them, we have the opportunity to give them a good death, to not force them to go through that suffering at the end when we know that the end is coming. So can you share a little bit more with us around what you believe a good death is? And let's talk about euthanasia. Let's talk about that gift that we can give them at the end.
Thanks, Danae. Firstly, let me say I'm very sorry about, the death of your mom. We're never ready for the death of a parent. And in our society where we fear death, I think it's even worse. So when we look at other parts of the world, death is a part of daily living. If you're in India and somebody dies, they died home, they put them on a carriage or whatever, they move them through the streets, take them to the Ganges, or take them for their funeral pyre, and life goes on around that body, around that dead person. But for us as Western people, and I'm particularly speaking about how we grew up in South Africa, death was the end, and we didn't talk about it. And so we have carried that fear and that inability to talk about it into our animals and our animals' lives. And we don't want to face it, and we don't want to talk about it, and we don't even know how, because it's not part of our culture. I do think that part of what we are called to do as vet rehabbers, because we spend so much time with our clients and so much time with the patients, is to have these conversations. So we really have to look internally. If you haven't had an experience of a family member or a parent or even your own companion animal dying, it's going to make you even more uncomfortable, because you're not going to know what to say. And because of society, we're going to go, okay, I can't face this. And for me, that's part of the discomfort and part of the dilemma and the ethical dilemma that we have. Yes, is the animal suffering? Yes, we can choose a good death, which we at the moment in our society don't have for people. And that's another conversation, and it's not one that I want to open on this forum. Okay, but we are able to do it for our animals. And for many of you, if you're not vets, I assume that you speak with vets and you work with vets. And for my own journey as a vet, I've had to go, okay, so how do I process euthanizing an animal or euthanizing an animal? And that is going to be personal for every vet. It was very personal for me. And I've got to the point, because many people will go, well, how can you do it? Like, how are you able to take a life? Yeah, and it's a life. It's never done without respect. It's never done without consideration. I'm talking from my own perspective and my own experience. And I reached a point where I realized that what I am able to do is, as you have rightly said, a gift.
Yeah.
So I view it as the final healing. So we are in a healing profession. We are in a profession where we are driven to improve the quality of life of our patients. And when we are unable to do that, as the patient approaches, we can't manage the pain appropriately anymore, or if it's a cancer patient, there's a lot of pain. If it's no longer mobile, our own value system starts to want to dictate what is right for that client and that patient. So that then comes in on top of the fact that we actually don't know even how to discuss this. And therein lies our dilemma.
Yo, I think you mentioned the kind of with vets what happens, and I think we understand that it's a very big cause of their unhappiness in the profession at the end of the day, right? Is the large amount of euthanasia that they need to perform, sometimes on a daily basis. So we're kind of familiar with that. And I love that you've brought in our own personal beliefs around death and then having those conversations. So something to think about is these clients that we're working with together with our vets, especially when we're looking at chronic pain patients or palliative care, where we're coming towards end of life decisions. What conversations has or have the vet not had with that client, potentially because of their own relationship with that act of ending a life, of taking a life? How do they feel about that? So that's actually a part of the kind of triage or conversation or team that I hadn't really thought about, and that is absolutely relevant and significant. So I like that. Thank you for bringing that up for us. And how we have those conversations is always difficult. And I love that you've brought up the personal experience, because when we have that personal experience, it changes the way we have the conversation. It actually makes it easier. I've found it easier to have that conversation because I can share my personal experience, and because it's shifted my perspective to, this is a gift, this is a blessing that we can give them. And I can share that is my own personal feeling around it. That's my personal belief around it. And I found that to be helpful to my clients. So I think that makes a difference. And I think it is just worth us speaking about it more. Mm-hmm. I've recently had a conversation with Celeste Lazarus. I don't know if you listened to that, Tanya, where we spoke about death with dignity and how can we send them off in a way that is honoring them, but also allows us to grieve and allows us to be present and allows us to go through it in a very conscious way, right? So I must say, for me, the experience of losing a dog or losing a horse, whether that was a decision that we made consciously, it's time, or whether that happened in a sudden traumatic fashion, it's always been very removed, right? So I'll take my dog to the vet, they'll do the deed, I'll say goodbye, and then that's kind of it. But what more could we do to kind of grieve and honor that life? And Celeste had some really good suggestions. So I'd love to find out from you how you take on that time, right? Maybe the last few days, the last day. Is there something that you do to make that special for the dog and for the client? Is there something that you do to support them in their grieving? How do you kind of support them in that time?
Okay, so first let me say I haven't watched the conversation you had with Celeste. So if I repeat things, I apologize. I have no reference point.
No, I think it's better because you're coming with your own thoughts instead of, so I think that's better.
So I want to go a little bit before we reach that point of making the decision. Because I think there's a very uncomfortable phase before we make the decision. And then I'll go to, okay, how do I try to ease it and make it special and so on. So what I see since I transitioned from normal small animal practice into vet rehab, I thought, great, I'll never have to euthanize another animal. I was so wrong, because in fact, I probably euthanize, I don't want to say I euthanize more, but they're more impactful because of the level of relationship that I have. And that's what can create discomfort for us, because we care for the human, we care for the patient. And now we are advising on end of life. What I want to say is that we all have our own perspectives. And what I have seen is, I will say, I have an old French poodle who is very painful in her back legs. And I am frequently asked, so would I put her in a cart? And where I stand right now is, because of the busyness and the other commitments I have in my life, I doubt that I would put her in a cart. Okay. And I'm not there, thankfully, but that's my decision for my dog. And I need to be very aware. You talked about being conscious and awareness. I need to be very aware and very conscious that I don't project that onto my client. So I might be faced as a vet rehabber with a dog that is now got hind limb paralysis, or it's a hind limb amputee and the remaining hind limb has severe hip osteoarthritis. And now the dog can't move adequately, and the client wants to know, can we put it in a cart? And instinctively I'm going, we should never put a dog in a cart, or I wouldn't put my own dog in a cart. But that is not where the client is. So as a vet rehabber, we have to remove the need to judge and to be critical, because that in itself creates dilemma. And we have to go, okay, let's have a conversation about what is feasible and possible for this client and this patient. If it's a large breed dog that needs a cart, then you start having the conversations about how practical is it. Maybe it's an older client who can't actually physically manage that dog and get it into a cart, in which case euthanasia may be a better option. So there's lots of factors. I'm just giving you one example, but there's lots of factors that come into play that we start to discuss as the animal moves to a point where, as a vet rehabber, our ministrations and our modalities and what we're doing become less effective. Because that's essentially what happens, is we get to a point where we are not able to make a difference anymore. And as a vet rehabber, if my patient is not improving, how do I feel?
Yes.
And this is another whole topic of, I start to feel like I'm useless, I'm incapable, I can't do anything right. And so my own self-image starts to go down. And that's also another topic, because we need to find our self-worth outside of the way our patients respond. So, sorry.
That's really powerful, Tanya. I'd love to go into that more. Actually, Lynn, thank you for joining us. You're saying that you're going through this right now. I'm sorry to hear that. It's tricky, it's challenging, especially when it's our own personal dogs. There's a whole nother of tricky and challenging when we're working with clients, but when it's our own, that's for sure. That's hard. So Tanya, I really love that you've highlighted that kind of, there's a difference of opinion between what you want or what you think is best for a patient and what the client wants or thinks is best for the patient, and whether that is, a cart, or whether it's making the decision for end of life, or going on to additional pain management, or whatever it might be, right? There are often times when we completely disagree with what they want to do, because we think that goes against what we would do or what we believe to be the best thing for the patient. What are your tips in those? Like, do you have some tips or advice in those situations where we think that the client's making the wrong decisions? We still want to be a part of the team. We want to continue supporting them and helping them, but we're finding this friction between what we think is best and what they think is best. How do we address that?
By having a conversation. Okay, but you can ask yourself questions like, one of my questions is, it's my perception this dog is suffering, but is that true? Okay, so whatever your perception is, is it true? So when I think about suffering, I do think about unmanageable pain. I also think about dogs that are not cared for. So in other words, let's look at an immobile dog. They start developing bed sores. They may be urinary and fecally incontinent, or one or the other. So are they being cared for in terms of that? Is their urine scalded? Is the patient's mental and emotional health being attended to? Or is the patient being neglected in terms of, for 8 hours of the day, it has no care? So frequently when we start looking at the nitty gritty, we will discover that actually that dog is being cared for, or that patient is being cared for. And although it might not be what we would choose, technically, if you look at the truth, the dog is not suffering, not physically suffering. It's perhaps not mentally suffering because it's getting care, it's getting attention, it has another companion, it's being moved it's being moved so that it can follow the sun, or it's getting different viewing points throughout the day. I mean, our clients are remarkable.
They are.
With regards to the lengths that they will take to make their dog happy. And happy is relative.
Yes.
Okay,
I
so
love that. Okay, so is it true?
Is it true? Secondly, so firstly, so you got to have the conversations. Okay. The next thing is, as a vet rehabber, I have the ability, I hope, to determine the mental well-being of this patient. So if I think that this patient is becoming depressed, or the patient's emotional needs are not being met, then I am responsible for raising that with the client and making them aware and seeing whether or not they are willing and able to attend to those emotional and mental needs. Because sometimes they don't know.
Yeah.
Okay.
And also to a degree, like, do they agree? Do they see the same changes that you're seeing? Are they kind of denying that in themselves, pretending that it's not happening? To what degree are they recognizing it? I think that's a part of that question.
Yeah. Yes. And again, every dynamic and every conversation is going to be different, because everybody in that conversation is bringing their own experiences to that conversation and their own knowledge. So it's not possible for me to say, if this, then that. I think the last thing that I want to mention, and it's quite difficult to navigate, and it depends on your relationship with the client. And a lot of this I only found out in hindsight. But you have no idea where that client is in their life. And if you can hold that and you can look after as best as you can the well-being and the pain management of that animal, because that's what we are tasked to do, then you hold a space for that relationship to run its normal course, for the people in that relationship to come to the decision.
I love that.
Okay, so it's not for you, actually, and I don't believe it's for a vet either, to say, you must euthanize now.
Yeah. I love that. I love that. It's like, just, yeah, I really love that. I've very recently had a patient who was boarding with me, who was very painful and really having a hard time with mobility. He's a laminitic dude. His shoes were a problem. They kept coming off, and then he would be completely unsound. And we were making great strides until he had a laminitic flare-up. What I want to share is that, from the beginning, from day one that he was with me, really he was a good candidate to be put to sleep already, because he was in high levels of pain. He wasn't fully mobile. There were a lot of things that were going on. but the owner didn't want to go there. And I didn't feel like I should have the conversation with her yet, even though it's a conversation I'm very ready to have, and I'm usually very quick to have. I just didn't feel it was right for them, and she came to me with the decision. When I wasn't ready, she was like, "It's time." It's time. And I have to say that was one of the hardest for me, because it brought up, you mentioned earlier, those feelings of inadequacy, because our patients aren't improving or responding. And I'd love to go into that a little bit next, because I think that's very difficult. What do we do when we feel like we have failed our patients? And I know that wasn't the truth in this case, but it felt true. It felt like my reality. And it often is. It often is. So that feeling, often is the way that we feel. So how do you recommend we deal with that in ourselves? Because we don't want to bring that to our clients. We don't want to bring that, into our professional lives. As far as I'm concerned, I feel like I need to deal with that separately, because it's a personal issue and not a professional issue. But maybe I'm wrong. So how do you recommend we deal with that?
Let's deal with the client interaction first, and then I'll deal with the personal one. Okay. So from a client perspective, you will have usually two clients. You will have the type that expects you to make progress even though it's not possible. So that will increase the pressure you're under. So you'll have your own self-talk telling you you're a failure, and you will have the client pushing you, going, why is it not getting better? Mm-hmm. And you can still ask, is it true? Is there more I can do? If the answer is no, then you really have to be very frank and honest with that client and say, there are no more medicines. You've discussed it with the vets. There are no more supplements. There are no more modalities that I have in my toolkit, in my toolbox, that can make a difference to your animal. The truth is, or the reality of the situation is, that your dog, cat, horse, whatever it might be, has a progressive condition, and we are now out of options. Mm. And even in having that conversation, I can feel, while I'm saying it to you, I can feel in my own body how that settles, and I start to go, okay, so this is not a reflection of me. I have done everything I can to ease whatever is going on with my patient. I have no more. So the self-talk is an interesting one, because I think inherently within the veterinary profession, we measure our self-worth by our success in terms of our cases. And it was a very big sigh.
No, but that's such a big point, because I'm like, well, duh, doesn't that make sense? That's my job, right? If my patients aren't improving, then what the hell am I doing? Yeah,
okay,
sorry.
But the fact that your patients don't improve doesn't make you a lousy human being. It doesn't make you a failure. No, because sometimes there is nothing left. There is nothing left. And then we want to give and give and give, and there's no more to give.
Yeah.
And then we spiral down into the depths of depression and the depths of despair and the depths of self-loathing. And I say this because I've been there. And the way to change that is self-reflection. And that is a journey that everyone takes in their own way. All I can say is it's very, very important for every single one of us, and every single one of the people listening, and every single one who listens later and doesn't listen, understand that what we term failure is not a reflection on us or on our ability. And so we have to start reframing it in our mind. Okay. And I can see your frustration, Anae, because it's like, but why not? Of course, I failed. No. Because we live in a society that says we should be able to fix everything. And sometimes, and especially when we're talking about end of life, we need to reframe it to how do we facilitate this transition?
Yeah.
Because the transition will happen. It's inevitable.
So, I mean, I feel like we create that as well for ourselves, because
Yes.
when we talk about the kinds of patients that we can help and we're having these conversations with vets, then it's like it's really anything where pain and mobility is involved. Like, we can help, we can make a difference, we can improve this. And so are we kind of furthering that belief through our words, through our communication, to kind of say that we can fix everything and we need to be able to improve everything, just kind of furthering in that belief. I think if I sit here and I'm trying to be honest with myself, because I do want to be honest with you, with our audience, with the people who are watching, with the vet rehabbers that are out there. I mean, the truth is I'm not in full clinical practice, right? I sit here in front of my computer serving vet rehabbers for the majority of my day. And then I dabble with a couple of patients every month, but it isn't a lot. And so I do feel that self-doubt and that concern when I'm working with my patients, if they're not improving in the ways that I want, or the clients don't make the decisions that I'd love for them to make. I feel that quite deeply and quite personally, and potentially it's because I'm not doing it all the time, and because there's this perception that because I'm learning continuously and in this teaching space that I know everything, and I don't. And I feel that from my colleagues, I get that those clinical questions and those feelings that I must know everything because I sit in front of my computer all day. So yeah, those are kind of my thoughts, seeing as we're going on tangents. Oh wow, I worked with a horse that chose to live, but not 100%. Well, it's lovely, but at the same time hard to lead with that. But he meet me with love every time we meet, because I was with him when he was very weak and gave love, but I can't tell at this moment if he has pain on a scale of 1 to 10, because he is showing no go and happiness, but I know that there are tissues that will not recover. The vet is aware too. Thanks for bringing this up. Always learning. This is always a tricky situation. What are your thoughts, Tanya?
I love this. We're learning all the time. I can just tell you, Anae, I'm a whole lot older than you. There is no way I know it all. And the more I know, the less I know. You know, that whole thing, the moment you open up a new can of worms, there's another whole spectrum for you to bring on board. Okay. And so I will get to Antonio's, to your question about Antonio and his horse. The pressure that we place ourselves under to know it all, be it all, achieve it all, do it all is tremendous. And that is a very, very big part of the problem. So we have to start going, well, I don't know it all. I can't tell you how many times I say to my clients, I'm sorry, I don't know. But I do know a specialist or a practitioner or a this, that could possibly help you better than I can, especially with the questions that you're asking. So I think we need to be kind to ourselves, essentially. Animals teach us all the time. So to come to the horse that is happy to see you, and although the tissue won't recover, what you are contributing to in terms of this horse is quality of life. And you are also respecting the horse. The horse has made a clear decision. So, like, I believe we are all sentient beings. And if a patient or a horse is telling me, I'm not ready, and I'm getting that message, even though I might be ready, the horse is going, I'm not ready, then we need to respect that. And within our capacity, hold that animal in as little pain and as little discomfort as possible. It doesn't mean there won't be any. Okay, we want 100%. We want all or nothing. We want total pain control. My little poodle has taught me so much, because there's certain drugs she can't take, and I'm tearing my hair out, and I'm going, are you, like, if it was up to me, I'd have put you to sleep long ago, because I can't manage the pain. Here, my pain point. I can't manage my dog's pain. And yet she shows me and the whole team here in Gauteng how ready she is to live. Hello, yay. Oh, and she's very she's going on for 14 and she is also very obstinate. It's like, I want to go there. All right.
Yeah.
I'm going. I'll find a way. Take me there, or whatever. Like, her mobility is not great, but so I think it's really important. And thank you, Antonio, for bringing it up, because it's very important for us to recognize that our own point of pain may actually be influencing our decisions.
Yeah. I love that. So let's go a little bit more into knowing when it's time, because there is this degree of where I don't know, is it like a feeling that we get that they're ready or they're not ready? How do you figure out when it's time? How do you help a client know when it's time?
I'm going to give you a very personal story. Forgive me if the tears start to roll, but I think it's going to demonstrate what you're asking. And if it isn't, we'll explore it a little further. At the beginning of last year, so at the beginning of 2023, I have 2 horses. The one horse, who is no longer with us, he's the topic of conversation, had been diagnosed with metabolic syndrome or Cushing's like 5 years previously. And he's my husband's horse, not mine. And we have been managing him with herbs and acupuncture and diet and movement, not excessive exercise, but we all know how good movement is for all of us. And he got to the point at the beginning of last year where everyone around on the property, all of the rehab practitioners, myself, could see that he was unhappy. And we intervened with a few other things, but essentially he stayed unhappy. And he started to lose weight. And then you could see he was painful. He spent a lot of time lying down. He's over 20. And I kept on saying to my husband, he's not well. I'll intervene here. I'll do this. But if he doesn't respond, his time is coming. And I firmly believe that it is the client's or the owner, whatever word you prefer, but it is the client's decision. So I was not able, despite my own pain and everyone else pressurizing me to euthanize the horse. My respect for my husband, and you can translate there, my respect for my clients is such that the decision is theirs. And I think that, like in vet school, I was not taught that. I was taught that the decision is mine because I'm the veterinarian. I don't believe that. So we're talking beliefs, and there will be disagreements, and that's okay. But my role as a vet or as a rehabber is to discuss what is happening with the animal. And yes, I can bring in my own experiences and my own thought processes. No problem with that. But in no way should I be judging the decision that the client makes. And in fact, to the best of my ability, I help my patient to stay comfortable and in ease. Yes, there may be pain, but the best of my ability as a rehabber to keep them in that space until my client makes the decision. And I firmly believe that when the relationship is there between the human and their animal, the human and their animal companion, they will know. And then they will come to me and they will go, okay. And so what I did with our horse, or my husband's horse, our horse, 20 plus years is nothing to sneeze at. Eventually, my husband came to me and he said, it's time. How do we do this? And then I can step in my role as a vet and a caregiver to say, here's how we go ahead.
Thank you for sharing that with us. I know it's not easy to share those those personal experiences, but I think that we love as professionals, let me phrase it this way, we love to have, objective quality of life tools, and let's look at, these things. Is your dog running or playing? Where do they find enjoyment in life? What are the things that they love? Are they still doing that? We try and make it objective and measurable. And I think that is good. There is a place for that because it helps us to have the conversations, and it helps us to bring awareness to the clients of some of the things that they should be looking at. So those are good. But the more I have these conversations, the more I realize that those things are not actually at the end of the day impacting really the decision at all. There's just, all I can say is that the client knows. They know when it's time, and there's not much else I can put to that other than they know, and you've confirmed that. And I think it comes down to that relationship. It comes down to that, is there a connection between them? Are they spending time together? Is the client watching and observing and connecting and being in the presence of this animal that they love, that's a part of their lives? And how relevant is that with dogs especially? It's easy for us to kind of leave our horses out in the paddock and turn a blind eye, but our dogs live in our home. We're around them every time we're home. So I think that it's difficult to not have that relationship, and I think that's really good. Yeah. Thank you for sharing that.
Thanks, Ane. I want to add something here, because it is about the tools that we have, like quality of life questionnaires and, all of the things that we are taught that we use. They are very, very important to bring awareness to a client. Remember that our clients don't have our training. They don't have our background. Well, some of them do, but the majority don't. And sometimes they simply don't know. I mean, how many of you, your client says, but I didn't know my dog was in pain. Okay. So I think that they, as you rightly said, they are important because they start a conversation. Again, where part of our dilemma arises is when the client is in denial. And what I want to just say there, which I tell anybody who works with me in a professional capacity, including veterinarians, is you have a right to refuse treatment. Okay, so if you move into a situation where it is untenable for you to be there, you have a right to say to the client, I am so sorry, but I really am not able to treat your animal anymore. And there is no shame in that. In fact, it will remove you from a situation that is causing you a lot of hurt and a lot of harm. Okay, and I'm not advocating that across the board as I don't want to have this conversation. I'm not going to treat the patient. Okay, but there will be situations where your hands are tied. There's nothing more you can do. And it's so uncomfortable for you that you no longer can bear to be there. Because clients may know. Fortunately, these days, in my experience, they're becoming less. Clients may know, but then they deny that knowledge to self.
Yeah. Okay. I think that is really important. Thank you for bringing that up, because I wouldn't have thought of that for us now, but you're very right. We need to remember that we can walk away when we have to.
Yeah. And that's not easy. And it comes with a lot of introspection and a lot of, but if I'm not treating this animal, who is, like, I'm not saying simply just decide. Okay. But I do want to say that you as a human being have a right to look after you as well.
Tanya, would you mind sharing a little bit about what our listeners can expect from you at the Vet Rehab Summit this year?
I don't kind of want to give it all away.
Don't give it all away, just an idea.
So Onlinepethealth asked me to speak about ethical dilemmas we may face in the vet rehab space. I have started with an introduction and a few things, and then I've really taken 4 situations where I think practically are our biggest dilemmas. And I've looked at, okay, well, let's talk about them and what are the things that we have to consider in each of those scenarios. So it's like I'm trying to sketch a scene, and in every scene we will have a client, a patient, and a rehabber, and look at where each of those might be within the scene that I've set and go, okay, what are the options?
I love that.
What I'm hoping, and that's entirely dependent on online pet health, is that we can have a good time afterwards for discussion, as opposed to I speak for 50 minutes. So if I can speak for less and we can open up to the delegates for a discussion, I think that would be helpful.
That would be
so that's what I'm anticipating. Sorry, I put you on a spot. You don't have to answer.
Oh, I wanted to shuffle the program a little bit, but let's have a look. No, I think that's really powerful. And it is actually the discussion component with this topic where we're looking at ethical dilemmas is very important, because one opinion or one way of doing things there isn't really a right and wrong. It's not like this is what you should do in X situation. It's really about what could you do, and there's more than one could, and so that discussion is really important. And I've been loving these Facebook lives in the lead up where we can discuss some of the questions and some of the challenges. My hope for the summit is really that, when we say ethical dilemmas in our profession, the first thought is like, what are you talking about, right? We have the best clients. It's a great profession to be in. It's actually a really great space to be in. But there are things that challenge us. There are things that get us up on our soapbox, and we might not recognize them for what they are. And I'm hoping that at the summit will inspire you to find that thing and then to do something about it, because we're not just here to moan and complain and, this is terrible and why would our clients do that? No. What are we going to do about it? How are we going to change our industry for the better? How are we going to take these things we've identified and change the world? I'm feeling very inspired. Okay, so guys, if you haven't registered yet for the Vet Rehab Summit, it's on the 31st of August. Tickets are available, but if you're an Online Pet Health member, you have free VIP access. We register you. It's all done for you. You just need to join us on the day. Block off your calendar so that you can be there live. It's the only way to really participate in the conversations. Otherwise, you'll be watching the recordings. The recordings will be available for 30 days, and then they'll be added to the members portal at a later date, so that they're there for your convenience, together with the majority of our past Vet Rehab Summits, which is quite an incredible resource. So if you're on the fence about an Online Pet Health membership, it's completely worth it. Jump in, be a member, join us at the summit for free. Okay, Tanya, thank you so much for your time today. It's been really great.
And thanks to Online Pet Health for constantly creating these spaces. I mean, it's really, really super. And thanks for the invitation. I've enjoyed it.
Awesome, guys. Have a great day.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.